We all struggle with feeling like there's not enough time in the day to be productive personally or professionally. We all struggle to make our time matter. It's time to take control. It's time to start investing in the corporation of you. At Athena, they've helped over 700 ambitious professionals achieve more by connecting them with best-in-class, globally remote executive assistants. Athena executive assistants go beyond basic administration tasks. They help you make time matter through the art of delegation. They believe delegation is the superpower of all highly successful people, and your personal EA will help you get there. Your EA is a one-on-one long-term partner to help you achieve your personal and professional goals. Take back your time. Join the waitlist at athenago.com. That's athenago.com.
I mean, no one plans to get sick, and yet, here we are. My name is Matthew Zachary. I survived cancer, a stroke, and COVID-19, and somehow I'm still here. I also survived our stupid, broken healthcare system, and I want to help you survive it too. So let's go make healthcare suck less together. Because you know what? We're all out of patience. Hey, that's the name of the show. Hello, everyone. Welcome back to the show. A quick reminder, as usual, before we get started, if you like the show, I hope you do, and you're on Apple Podcasts, please consider leaving me a review, a rating, a star, something. I really need to know that you care. On the show today, returning champion Dr. Jean-Luc-Neptune, founder at Suntra Modern Recovery. This is JL's third time on the program, but what makes this appearance even more remarkable is that we taped the show in person. In person! We're both fully vaxxed, and I think I was the first person he'd seen in real life since the pandemic. Of course, he has family, but you know what I mean. Besides being a medical doctor with an MBA from Wharton, JL is funny as hell. He's got a slick wit, great insights into public health and consumer behavior. So join us today on the show as we embark on a no stupid questions rampage about all the fuckery afoot about things maybe getting back to normal. Let's find out. Jean-Luc-Neptune, live in person, here in my studio. Holy shit.
Hi, Matt. How are you? Thanks for the invite.
It's nice to see you, and I mean see you in person. Are we doing better in terms of, is this normal? Are we hopeful for normal?
I think we're getting better. I think we're turning a corner. I think we're making progress. I think that mass vaccination has had a real clinical impact. I think you're already starting to see it reflected in hospitalizations and deaths. So I think that's really significant. And I think that there's a lagging piece to this of what you might call consumer psychology or individual psychology, where people start to get more comfortable and more confident. And as I explained to you, I got my second Moderna shot about 2.5 weeks ago. I got my shot on a Saturday, and the Monday after that, 2 days after getting it, I was planning business meetings with people that I knew were already vaccinated. I was looking into a WeWork spot. So I think that this vaccination drive is definitely helping, and I think we're getting there. I still think we have many, many months away, and I think that COVID is going to be with us for a long time, maybe years. But in terms of trying to get back to a semi-normal life where people like me and you can meet in person and talk business and be regular human beings and regular New Yorkers, I think that's happening now. And I think by the end of, by summertime, I think we'll be fairly normal,
It must be fascinating to wear both an MD hat and an MBA hat in a time of such social disruption, how the free market has responded to consumer sentiment and how science and medicine is trying to live somewhere in between them in terms of hesitancies and trust, and how, as of this recording, they pulled the J&J vaccine because 6 women out of 7 million doses have shown, and then 1 in 10,000 women get clots from the birth control pill. 1 in 1 million women get clots from the J&J vaccine. What's your thoughts on public sentiment and awareness and messaging?
I mean, I think J&J is, the J&J vaccine is really a quandary because, at a time where we're trying to build confidence in these vaccines, a lot of people are looking for reasons not to get vaccinated. And I think that, as a physician, as you mentioned, one of the hats I wear, you walk a fine line. You want to try to make things as safe as possible, right? And make sure that, whenever we talk about new drugs or new interventions, we're always talking about safety and efficacy. And I don't think people understand how much doctors and other people involved in the approval of medications worry about safety and how important that is. But, you really have to ask yourself in a vaccine trial where you're seeing 1 in a million events at the same time that you're seeing lots of vaccine hesitancy and people looking for reasons not to get vaccinated, whether it really made sense to pull the vaccine. Again, I'm not the FDA, so I don't see all the things that they see. But I think there's a real challenge here between the public sentiment and this huge group of people who are vaccine hesitant, who are distrustful of the government and distrustful of doctors, and our need to get people vaccinated. And, the other group of people like us who are lining up to get vaccinated so that we can get back to the normal world. It's very challenging.
Yeah, one of my colleagues was at a CVS getting her vaccinations. And normally you're at a CVS lined up and everyone's just chit-chatting or whatever. She said everyone who was waiting that 15 minutes to see if they flaked out after you get vaccinated was giggling with joy. They're I can't wait to get back to life. I did this thing. And you got to wonder, where are other people getting this perspective of either disinformation, which we know is very obvious in the media, versus a hesitancy because they just don't have the capacity to understand the science. But at the same time, should we expect them to have to understand the science? Because quite honestly, it's science's job to speak science, but who's interpreting that to the average person?
Right. And I think the big problem is the people who are communicating the information to individuals. Many of them are communicating disinformation and probably doing it intentionally so, right? As trolling, as entertainment, or maybe just as part of their philosophy of being against vaccination, being against the government. So, I think when we talked the second time that we spoke, we talked a lot about this. We talked about disinformation. We talked about, how do you get people the truth? And I still don't think we've found an answer for that a year into the pandemic. My wife was telling me about a friend of hers whose mother died of COVID. She married into a family where there were a number of people who supported the former guy, right? And apparently those people were not wearing masks at the funeral, or they were cleaning out the house. They're not wearing masks. They were making fun of her for wearing a mask and for being overly cautious. And there's just a lot of Americans who are living in a different information reality. And I don't know if we figured out the answer to that yet.
When we did our show more than a year ago, you were my third or fourth guest on this show, we talked about, it was colloquial, but how we're going to see how states' rights and sort of citizen information disinformation are going to be their own viral eugenics in a sense. And where I want to go with this question is that we saw that California and Florida took very opposite perspectives. California's quick and hide, and Florida's what's COVID? And at the end of the day, they ended up with the same net per capita number of diagnoses and deaths. Do you attribute that to compliance?
Well, I think it's important to remember that we talk about California and we talk about Florida as if they're monoliths, right? They're giant states. Florida's population is 20 million. California's population is 40 million. And, those states are as heterogeneous as New York is. And I think maybe the net result being the same has to be interpreted through all the different communities that exist, right? So even within Los Angeles, you could say Los Angeles is very educated, blue state type people who are running to get the vaccine. Los Angeles is also a lot of working class new immigrants who might be more reluctant to take the vaccine. So I think, yes, there's the strategy that the states take and, how they approach their public health efforts, but there's also the underlying substrate of the people and how they respond to those things and the resources those people have. And, I think it's very complicated.
Well, like a social bell curve per se.
Yeah.
Right. So whether Florida said what's COVID or not, a certain portion of the population is still going to be more risk averse and want to mask up and want to protect themselves, but a certain population of Florida is not.
Yeah.
And the same could be true of California too. So the net balance really is that ideal median bell curve for compliance.
And I think also this is a story that's still in progress. The pandemic is nowhere near over. We're still talking about, I don't know what the number of deaths per day in the United States is, but it's still a significant number of people are dying of COVID. I think that once the pandemic is done, and, certainly once we've gotten to the point where all the people who want to be vaccinated have been vaccinated, then I think you might start to see differences in the philosophy, right? In, the individual states or counties or cities' philosophies. And I continue to believe that, and this was proven in 1918 with the flu pandemic, the areas that were most conservative in their approach to the pandemic did the best in terms of deaths, economic turnaround. And I think that will still be proven in the future.
And that goes to my question we talked about before the show, this notion of sort of geo-targeted herd immunity, right? Herd mentality, according to the last guy, but herd immunity, which I think still people don't understand quite what that means. And I don't want to make this a one-on-one explainer, but clearly we talked about like there are pockets of blue and pockets of red and pockets of purple, and those communities may have their own herd behavior per se. Are we looking at herd immunity potentially in geo-targeted locations? It's like saying the P part of the pool is over here, but is that a thing we could think about?
I always love that that analogy. There is no peeing section in a pool, right? So I always find that funny. I think what it's probably going to come down to is, as we live here in New York City, right? There are 8.5 million people in New York, and I think if you don't live in New York, you don't really understand that in New York, yes, it's a big city, but most of us live in relatively small communities. So, I live on the Upper West Side. My kids do West Side Little League. Most of our friends live within a 5 or 10 block radius. Almost all of those friends are lining up first thing to get vaccinated. So, I think what's probably going to happen is maybe it's a geolocation, but it's almost like like your cohort location or your tribe location, whatever tribe you're part of is going to determine how people do. And I think, in New York, we're going to start to feel I'm going to walk into a birthday party where I'm going to be comfortable going because I know that every single person in that party has sort of a similar mindset and is probably vaccinated. I know I'm vaccinated myself. And I think that's going to be like, the herd immunity part. We just know that mini herd, that mini tribe is immune.
Like a microcosmic herd moment.
Microcosmic herd moment. And then people like me are going to avoid places where we think that we might be interacting with another herd that is not vaccinated. So for instance, I've told my wife, like, look, we've been in this house for a year. We need to do a big trip. We need to go to the Grand Canyon or something. My wife said, absolutely not. We are not getting on an airplane. And she's right. Like an airplane, it might be one of those places where I might be exposed to somebody in a herd that's not vaccinated. There is a guy named Robert Pearl. I was on a Zoom panel with him yesterday. He was the former CEO of Kaiser Permanente, and he wrote a book called Uncaring. And the panel was a little bit about his book. But he said that he was on a flight from San Diego to New York, and the woman sitting behind him was coughing the whole flight. She was flushed, red-faced, like COVID until proven otherwise. And when he mentioned that, I was like, I can't protect that. If I show up in my seat and the person behind me is COVID, I can't do anything about it. I'm vaccinated. I think I'm protected, but is it a Brazil variant? Is it a South African variant? I don't know. And I think not getting into those environments is probably a safe thing.
So let's go back to your MBA hat, because that's a perfect way to go into this other conversation of how the free market may decide to create these vaccine-only concierge moments in travel and hospitality. And we're seeing this in the cruise ships. Like many of the cruise ships are like, you must present proof of vaccination through some kind of passport. We'll get to the passports in the second part of the show. And people are losing their shit. Why can't I go on this thing? But I mean, as a sidebar, most cruise ships in America leave out of Florida, and DeSantis said you can't do this, so the cruise ships are pissed. But if you fly to, I don't know, like Mexico and take a cruise, there are vaccine only. It doesn't rule out the Ebola shit that happens with the other food stuff. Right. But can you foresee a moment where like JetBlue or Delta will start to create vaccine only flights if that meets kind of their margins for their revenue model?
Absolutely. And I think for a lot of these businesses, the only way that they can get back to a semblance of normal is by creating confidence for the customers that they want. So at the end of the day, it's going to be, the JetBlue customer is different from a NASCAR customer. And I'm making a general assumption, right? I think most JetBlue customers
Speak for yourself.
are, liberal elites, if you will. And I think most of them their target customer wants to be in an environment where they feel safe, where they feel other people have been vaccinated. And even though they may be vaccinated themselves, they don't want to be exposed to people who have not been vaccinated. So I can easily see JetBlue saying, no shoes, no shirt, no vaccine, no service, And as I was walking along here on Fulton, I saw a deli that had a sign in the front that said, no mask, no service. And I could easily see somebody adding a thing on top of it that says, no evidence of vaccination, no mask, no service.
I love that idea of, do you think that would create some degree of consumer guilt or pressure? Like, hey, I want to join the cool kids club, like when Facebook was EDU only, right? Uh-huh. What do you think about that?
I think it will create some pressure, but remember, we have a weird psychology. I think a lot of people are going to start to say, well, F you, brand X that's forcing me to get vaccinated.
Boycott this, boycott that.
Right, exactly. And we're seeing it now with the MLB, unrelated to vaccination, more around the Georgia voting law. Right. But all of a sudden, baseball, which is their fan base is largely a Caucasian, white American fan base, all of a sudden people are turning against MLB because of their involvement in the Georgia voting restriction situation. So I think that might be the next stage is hyper polarization where, maybe JetBlue used to be 70% coastal elites, 30% red staters or whatever it is. Maybe JetBlue becomes just all blue because their customers who might be from red areas, and again, I'm making very broad generalizations, say, we're not flying with you. We're going to be flying with Southwest or whatever other airline is more permissive.
Cue the business plan for Jet Red.
Jet Red, exactly.
Because I'm still perseverating on this notion that people are going to say, you're infringing on my freedoms and liberties, and people don't really understand at large that a private business can do what the fuck it wants, and you have no control over it. Right. But I want to take this conversation to children in schools, which is something that has been driving us crazy as parents of young kids since this started, and millions of other parents of young kids, and largely like elementary school, maybe early middle school. Do you feel that it's right for public school systems, taxpayer dollar public school systems, to mandate the COVID vaccine to children when it's available as part of the same MMR requirements and early childhood vaccinations? No vaccines, no public school.
I'm a physician. I support that position. I think, it raises very complicated questions about individual rights versus the rights of a community of people, and ties so much into our history. And we forget as Americans, how many hundreds of years of history tie into these decisions and these laws. But I think if you're going to require kids to have the measles, mumps, and rubella shot, to be polio vaccinated, if we have this pandemic ongoing that is way more deadly than the flu, way more infectious than the flu, it'd be insane not to mandate COVID, a requirement for a COVID vaccine. So if I have an opportunity to vote on that or to support a candidate who's going to make that policy, I'll do that.
Back with our guest after the break.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
So let's pick up on kids, right? As of right now of this recording, I think the vaccine is available for 15-year-old minimum?
16 and over.
And I heard 100% efficacy for some of the vaccines.
I think one trial so far involving children, I think that was the Pfizer vaccine, and 100% efficacy, right? And the way they look at efficacy is they look at the number of cases in the unvaccinated population, compare. So if you have 1,000 people vaccinated, you have 100 people who are diagnosed with COVID in the unvaccinated population, and that goes to 0 in the vaccinated population, then you'd say 100% efficacy in preventing infection.
So let's talk about another bell curve, which goes back to like the Gardasil conversation, is if you're a minor and you want to get vaccinated for your own personal needs, your parents are still in charge of allowing that to happen?
Right. I think so. I don't know about that. I do think that as a child, you require your parents' approval. And I guess if you're a kid and your parents don't want you to be vaccinated, I guess you can't be forced, I don't think.
Because I'd hate to see, and I'm sure we're going to see, tons of teenagers in certain markets that want to get vaccinated because they're of a different political perspective and a different generational vantage. And their parents don't want that for them because they have different purposes and views.
Yep. And look, your kids are in public school, right?
Yes.
So, as you know, as parents, public school parents, we've had a choice between doing in-person and doing virtual. And I think, when the decision comes down that you have to, and I do believe that the DOE will require children to be vaccinated. For the parents who say that they don't want it, I think they'll be able to say we deserve some accommodation because of our views or our beliefs. And I think you'll have a virtual only cohort of students who are, getting classes while the other cohort of kids are in school 5 days a week.
It makes you wonder how the whole private sector, no shirt, no shoes, no service, applies to public health in taxpayer-funded mechanisms like public schools.
Sure. And remember, I'm not a lawyer, but I did a little law stuff.
You play one on TV.
I did take a bunch of law classes when I was an undergraduate and in business school. You can't discriminate based on somebody's gender, their religion, their race, and then there's sort of their creed. And, I think for a lot of people, they can say, well, our creed is that we don't want to be forced to be vaccinated. So I could see this kind of thing being litigated in the courts and making its way to the Supreme Court as to whether the state can force individuals to be vaccinated against the coronavirus. I think that'll happen.
I mean, the whole point of all of this was like states' rights. And thankfully now there's federal leadership guiding the states that can choose to do certain things in a more structured way. Mm-hmm. I'd hate to see this go to a federal conversation to decide states' rights on public health.
Yeah.
It's like the speed limit, right? In Montana, you can go as fast as you want because it's Montana.
Right.
But here it's 25 on Ocean Parkway and I want to kill myself. But let's talk about that in terms of like the class warfare conversation. If there are communities of color or of disenfranchisement or socioeconomic disparities who would love to get the vaccine but can't, and their children can't go to public school because they can't get the vaccine, does that create another Morlock Elor thing like from Time Machine?
Mm-hmm. I think it does, but I do think, the word of the day in healthcare is equity. And it's amazing how many panels and discussions I've watched recently where people are talking about vaccine equity. So I think in the early part of the pandemic, from the time that the vaccine was first approved, I think communities of color, underprivileged or underserved communities have been vaccinated less. But I think there's a huge effort to catch up and get those communities vaccinated and get people on par, get the country on par, regardless of where you live or what you look like or what your income is like. Because at the end of the day, even if you're vaccinated, if that virus is spreading rampantly through other communities, it could still impact you. As we talked before we got online, if variants develop because a group of people is unvaccinated and that variant can break through your vaccine, it hurts you, So you may be vaccinated, but and may think that other people not being vaccinated doesn't hurt you. We're all sort of tied together, especially when it comes to a pandemic. And the better job we can do getting everybody vaccinated quickly, the better off I think we'll all be.
I want to focus on that specific health equity conversation because it's been a narrative for God knows how many years. I mean, just from your perspective, pandemic notwithstanding, you've been working in the space for a long time now. Has that needle moved at all? And if so, what have been the influencers to, like we talk about trial awareness and traditional cancer-based things and stuff, whatever. I just totally derailed the science of cancer things and stuff. Like, what's your take on the last decade or 15 years or so on health equity?
I mean, I don't have data, but I think the mere fact that we talk about health equity and you see it in headlines, you see it all over the digital health space, people are concerned about health equity. I think that's very significant. I think the consciousness has changed. And I think that people have come to understand that there is an inequitable sharing of health resources, or traditionally there has been. And going back to what I was saying before, that has an impact on everybody, right? That we are all connected in many ways. So I think you're seeing investments in startups that are trying to solve that problem. I think you're seeing state and federal funding directed at equity or inequities and addressing those inequities. I think we have a long and complicated history. I think those inequities run very deep, and we're a long way off from addressing or equalizing, if you will. But I do think that there is a change in consciousness, and some of it is like George Floyd changed people's consciousness, and seeing some of these videos that we saw, that guy Dante Wright who got shot. I think that's changing. That has nothing to do with healthcare, but I think that's changing people's perspective as well, and getting people to realize that health equity is a problem.
And it's unfortunate we need such shock value to change hearts and minds, which is just ludicrous in my mind.
Yeah.
So what are you working on these days? And how has the pandemic either fucked up or helped what you're working on these days?
So I'm working on what I was working on when I first spoke with you, or last time we spoke, Suntra Modern Recovery, hellosuntra.com. And, what we do is we are a modern system for helping individuals and families get access to the addiction resources that they need. And we really have two customers that we work with, or two groups. We work with families who have an addicted member of their family who needs help. So we can do an intervention, help people find the right treatment setting, do at-home detox and things like that. And then for the addicted person, the person who's dealing with the substance use disorder, we can provide intensive recovery coaching. We can support them before and after they go to treatment, and provide a much more intensive, immersive environment for treatment that allows them to get treated more intensely for a longer period of time. And the evidence shows that the longer you're treated, the more intensely you're treated, the better that you'll do. So we've been doing that. We've grown the business quite a bit since we last talked. We are looking to raise a little bit of money as we speak. And, in terms of this pandemic, I think the pandemic made addiction crisis much worse, because for so many people, they were stuck in their homes. They didn't have the same outlets they had. For a long time, it was hard to find an in-person AA meeting. If you did find one, you were standing outside in the cold in a church parking lot or something like that. And obviously stress can exacerbate an addiction. So show me a situation where people are worried about dying, they're worried about their incomes, they're worried about their communities. I mean, all those things really come together to make addiction worse for a lot of people. So we've definitely seen it pick up.
Yeah, I don't have the data in front of me right now, but suicide is up a tremendous percentage because of the pandemic, especially in teenagers.
Although interesting that
and doctors.
Although interesting that you say that, I saw some published data for 2020 that suicides nationally were down 6% in 2020.
Across the board, or?
Across the board. And again, like anything, right? I mean, there might be certain populations where the numbers are up, maybe in children, maybe in addicted populations. But I think actually the number that I saw was that the suicides were down 6%.
Because I have a colleague who works at a hospital in Minnesota.
Okay.
And she had 4 people on the staff kill themselves last year.
Right. So it's staff, right?
Right.
So, if you told me that physician and nurse suicide rates were up 50%, I could believe that. Right? Because it's been so, in many ways, this is the unseen part. So many people are like, well, COVID doesn't impact me. I live in a place where nobody has it. It's not a big deal. They don't understand that physicians and nurses and other healthcare people have been getting burned out and are leaving the profession. Suicide rates are up. So what that means now is when you need to go get your healthcare, the doctor or the nurse who would have taken care of you is not there, or they're less engaged, they're less capable of doing their jobs because they've been punished relentlessly by this COVID pandemic for the last year. And, I totally believe that number that you mentioned of 4 doctors or whatever have killed themselves.
So let's talk about hope, right? Let's wrap up with some hope. We're looking at these potential geo-targeted herd immunity moments in different cities and, the pea side of the pool, notwithstanding, but vaccinations are going to be up. Where are you on optimism over the next couple of weeks, couple of months?
I alluded to before. I feel much better than I did even 4 weeks ago, right? Even before my first shot. I'm much more optimistic now. I think the mood in the country is more optimistic again as people have the ability to get vaccinated. If you want a vaccine now, you can, there are endless appointments you can get at the Javits Center. Anybody can go. I think that being able to get vaccinated creates a lot of hope. Understanding that once you've been vaccinated, your chances of getting very sick, your chances of dying go down a lot. I think that makes people feel optimistic. The notion that the weather is getting better and now I can get together with unvaccinated or with vaccinated people and, have a barbecue or play a soccer game and have fun. I think I'm much more optimistic than I was before. And I think that's only going to build as we sort of come back together as a community. I still think it's a long fight. I remember Fauci saying that masks are going to be with us through the end of 2021. I can believe that. I think we'll be battling these variants to some degree. I think, this is not, you and I have both been vaccinated. This is not our last vaccine. I think we'll have to get boosters. We'll have to get revaccinated again. I think we're going to be dealing with a big part of the population that doesn't want to get vaccinated. So we're not out of the woods yet. But I think, compared to where we were 4 weeks ago, 6 months ago, or when we talked in March of 2020 or February 2020, we're in a much, much better place now than we were then.
No shirt, no shoes, no vaccine,
no service.
Jean-Luc-Neptune, my good friend from God knows how many years ago, #Halogica, the founder of Suntra Modern Recovery. My God, it's good to physically see you and to have you back on the show.
All right, and thank you for having me back, and look forward to collaborating more in the future.
HelloSuntra.com.
HelloSuntra.com.
That's all for today, folks. If you like today's show, be sure to subscribe, leave a review, follow us on social, and tell all your friends to listen. Out of Patience with Matthew Zachary is a product of OffScrip Media. Our executive producer is Matthew Zachary. Our senior producers are Brianna Seeley, Jen Oranger, and Andrew McDowell. It is mixed and edited by Brianna Seeley. Our theme music is by the Mike Van Allen Quintet and by Mara. For advertising and media inquiries, email media@offscrip.com. Hit us up at contact@offscrip.com to share comments, feedback, and make recommendations. For more information, visit offscrip.com.